Hi, my name is Dobie Moser, and I have the privilege of leading our Saint Ambrose mental health ministry. And today we're going to briefly look at accompaniment and specifically talk a little bit about our mental health ministry here at Saint Ambrose. And for any of you that are watching that are not part of our parish community, I would really encourage you to take these ideas and do what you can in your setting, whatever church that might be. We know that there are people with mental illness everywhere. And as a church, we want to respond in a way that is life-giving to them, and I believe life-giving to our community. So when we began our mental health ministry in 2021, we identified three essential components. The first would be education. And what do I mean by that? Well, again, healthy families, healthy organizations, churches in this case, talk about things that matter. Well, mental illness matters. Mental health matters. So consequently, you want to make it so that in your church, whether it's in a bulletin, on a bulletin board, in different sessions, our parish community talks about things that are important. And specifically, we literally put resources into bulletins. We did reflections. We did articles. We gave handouts. Anything that would make anybody out there that was struggling with this know that, hey, this is a community where we can talk about these things. This is a community that knows how to connect with whatever's happening in the lives of our people. And that education piece takes on some very real things. For example, we are doing a mental health first aid kit that is an all-day training done by NAMI, the National Alliance on Mental Illness. And that training allows people to be attuned to, aware of, what do they need to know for mental illness so that they can be sensitive and more effective in helping other people. Literally, our clergy, I really want to commend them, talking about it in a homily, including it in a prayer, so that it's not a forbidden topic. It's something we talk about because it's important. We have made efforts in the education front to making sure the staff is aware. What do they need to know? So when they're dealing with somebody, whether it's the individual, him or herself, or the family of that person, that, hey, this is a mental illness situation. What do we need to do to help? The second piece that we're attentive to, that is one of our building blocks, is advocacy and partnerships. So there are many, many people of goodwill and organizations out there who are committed to addressing mental illness. And we don't have to do it all by ourselves. So consequently, finding out who they are, what they're doing what we call plug-in events. St. Ambrose has had many of those. The great thing about plug-in events, other people do all the work. What you need to do is get people together and get them there, or bring that program to your church and just have people show up and experience it. And again, they can be speakers, they can be workshops, they can be videos like this video. Those are simple plugins. They're out there for whoever might benefit or want to use them as they need them. Now, I want to give a specific example because it's a really important one, something called QPR training. Just like you have CPR training for the physical threat of the end of life. Well, QPR stands for the acronym Question, Persuade, Refer. Here's a cool part of QPR training. It is a 1-hour training, and the goal of it is to know what questions to ask, how to persuade or refer to somebody who may be considering ending their lives by suicide. Well, knowing what to say and do in that urgent situation really matters. And QPR most often is used related to young people or young adults that may be considering ending their lives that way, but it's not only for them. And many of us in the literal fright of that experience, if we become aware of the risk, would reasonably say, oh my gosh, what do I say? What do I do? How do I help so that this does not go in a bad direction? Well, QPR is a plug-in training that we've done multiple times, and it's free. Life Act is one here in Northeast Ohio that provides that, but there are organizations around the country that do that as well. The third part, and this is really the lifeblood of good mental health ministry, is accompaniment. And accompaniment is about walking or journeying with others so that they're not alone. The distinction I would make is if you've ever seen somebody that is flustered, they're driving, they're having a hard time, they're lost, it's one thing to just give them directions and landmarks and tell them to go there. It's a whole nother thing to get in my car, lead them, they can follow me, and then know where to go. Now that's in a vehicle, but accompaniment in a relationship means checking in, calling, speaking with them, maybe taking them to a medical appointment, helping them learn who they can call, where they can turn to. So accompaniment at the heart of it is about a relationship. It's about a relationship that says, not only do I care and not only am I here for you, I actually will walk with you and go with you to help you so that you are not alone. Accompaniment is one of those quiet things. It's not a public part of the program other than people know that we do it. And most often, we actually are accompanying the family member of someone with mental illness. A brief story, we did a major conference in February called Accompaniment in Mental Health Ministry. You can check it out on our website. All of the sessions are there. It's free, wonderful high quality video and audio. And we had Bishop Dolan from Phoenix came in to give the keynote address. Well, by amazing grace, we have a woman who comes to one of our mental health support groups here at the parish, and she has a daughter in her early 40s with very serious mental illness. And so much so that this daughter is in a low budget hotel, will not come out, will not interact with people. It's a very difficult situation with a very serious mental illness. Well, Linda, this woman, won't give her last name, literally went out over Christmas to try to get time with her daughter in Phoenix and to bring her back to Cleveland to get the help that she needs. And when she went out there, picture this woman who did this was in her 70s, and she had to go to a new city alone, trying to drive around Phoenix. And we contacted Bishop Dolan and the Diocese of Phoenix because they also have a mental health ministry. They reached out to Linda and said, we'll pray with you, we'll offer you encouragement. How can we help you to know where to go, what to do? And when Linda came back, and sometimes this happens, her return was not a happy return with her adult daughter with serious mental illness. Her daughter was not ready to come back and get the help she needs. That happens sometimes. And yet, Linda knew she wasn't alone. She was prayed with, she was cared for, people checked in with her every day so that she could get through a very hard experience. And at the end of the day, what was she trying to do? To love her daughter who has a very serious mental illness. You know, the pastor and staff, when we talk about accompaniment, even accompanying them so that they know as they deal with families that come to a priest because they know they trust them, they're cared for. Well, when that happens, our staff here knows they can turn to us and we will reach out to that person and help them get resources. You know, the idea of it would be nobody's alone. Accompaniment is not about providing therapy, clinical services. We do not do that. But we provide a relationship rooted in love and friendship to help that person take the steps they need to help the person they seek to help. And our closing prayer, Lord, bless all those in need in mind, body, or spirit. Hear our prayers and grant what we seek in your time and in your way. And until then, hold us tenderly in your arms of love. Amen.